We discuss all this in order to learn what is acid-base imbalance and how the respiratory regulation of this acid-base balance will occur. Why the body should have mechanism to regulate and recover acid-base disturbances. Because when the plasma pH change from the normal range of 7.35 to 7.45, if it is decrease or increase, it affects the function of the body. How? If plasma pH decrease below 7, enzyme denaturated, lethally denaturated, and most of the function of the cell and body is by the enzymes. And if it is increased, it's also not good. If it becomes the pH rises above 7.6, it's very high. At this level, free calcium concentration falls, and it falls enough to produce fatal tetany. Of course, before that level, it's also fall, but at this level, it falls enough to produce fatal tetany. And the condition is here fatal. Why decrease? Why increase in the pH affect the free calcium concentration? What are the relation between these two? Of course, you received this in the metabolism module last year. And what's the relation of free calcium with the pH? Both calcium and hydrogen ion bind to the same plasma protein, and both of them compete with each other for the same plasma protein in order to bind it. So when the pH rises, means H decrease. When the H decrease, less H available to bind to the same plasma protein. So most of the calcium will bind to the plasma protein. So what will happen to the free calcium? Because most of the calcium bind to the protein, so the free one decreases. So the free calcium or the ionized calcium concentration will fall down. And falling and decreasing of the free calcium, as you know, will cause what? As you take in the membrane and receptor module, decreased calcium cause increase in the excitability. Increased neuronal excitability cause a muscle spasm, and if it fall enough to produce fatal tetany, means the spasm or the free calcium, if it decreases so much, of course the free calcium is active and it's cause function. That's why changing free calcium is important and has effect on the body. So if it decreases too much, the spasm is not only involving the carpopedal or the hand and feet, it also go to the other proximal muscle parts of the body and even into the larynx and cause suffocation and even death. What are the mechanisms of acid-base balance? First of all, we have an immediate mechanism, which are the presence of different buffer system inside our cells, inside our body, like phosphate buffer system inside our cells, bicarbonate buffer system, and protein buffer system, for example, like hemoglobin and other proteins inside the blood. And these are an immediate, they are very rapid, within seconds they act, but they are not so much effective. We have respiratory regulation, which need 1 to 15 minutes in order to take effect. And we have renal regulation, which is the most effective one, but its effect is delayed. It needs hours to days in order to take effect. All of them are important. This one become activated before that one. This one then in order to act until the other mechanism or other regulation become activated and effective. Respiratory regulation first. As you know, CO2 is inversely proportional to alveolar ventilation. What does this mean? CO2 is inversely proportional to alveolar ventilation. So whenever alveolar ventilation increase, CO2 decrease. Why? Because of the removal of CO2. When we do hyperventilate, we remove more CO2 from our lung. So CO2 is inversely proportional to alveolar ventilation, but be noted, we can't say alveolar ventilation is inversely proportional to CO2. It is direct because it's opposite. When we increase alveolar ventilation, for example, we decrease CO2. Or so when we increase alveolar ventilation, what will happen? CO2 removal increase. While when there is change in the CO2, what will happen? CO2 when change, CO2 for example increase, there will be hyperventilation. Increasing CO2 will cause increase in hyperventilation. That's why we said this one is direct. So CO2 is inversely proportional to alveolar ventilation, which means that increased ventilation or hyperventilation result in decrease in the PCO2. As you know, pH is equal to the minus logarithm of H ion, and this is the same equation that we discussed. This is the standard buffer equation, and increase in the CO2 means decrease in the pH, as we said, because of there is increase in the H. While when there is decrease CO2 means decrease H. So it means there is increase in the pH. That's why CO2 is so important. What is acidosis and alkalosis, and how we can differentiate if it's respiratory acidosis or alkalosis, or metabolic acidosis or alkalosis? So, whenever you have pH below 7, whenever you have pH below 7.35, it means this is acidosis. Whenever you have pH above 7.45 means you have alkalosis. But how we know if it is respiratory or metabolic? If it is caused by inadequate ventilation, this means that this acidosis is respiratory acidosis. So if it is caused in the alkalosis, if it is caused by hyperventilation, so this is the primary cause is respiratory, so this is the respiratory alkalosis. What about metabolic? How we know if it's metabolic? If it is a result from any cause or all condition other than the respiratory. So the decreased pH is due to any cause other than respiratory means it is metabolic acidosis. If the increase in pH is due to any cause other than respiratory means this is metabolic alkalosis. In all four situations, we have compensatory mechanism. The body has homeostasis, of course, you know, and control mechanism try to compensate for these abnormality. First, we have respiratory acidosis. The causes of respiratory acidosis like depression of respiratory center, and as you know, respiratory acidosis happen when acidosis يعني increase in the H. Okay, increase H يعني increase in the CO2. Okay, CO2 ضربة when there is hypoventilation, inadequate ventilation, because of less removal of CO2 from the body, from the lung. So could be due to depression of the respiratory center, or due to neurological or neuromuscular disease. You know, if the muscle do not work properly or the neuronal signal is not good, this will cause inadequate ventilation also. Airway obstruction in the severe, mostly in the severe cases. Damage to the lung tissue. All these will cause respiratory acidosis. In respiratory acidosis or hypoventilation, CO2 level increase, and so H increase and pH decrease. And in this case, kidney should compensate. So whenever we have respiratory acidosis or alkalosis, kidney should compensate. But whenever we have metabolic acidosis or alkalosis, respiratory system should compensate. For example, if removal of CO2 from lungs is less rapid than its production, which means hypoventilation, alveolar PCO2 rise, so dissolved CO2 rise more than HCO3. Do you remember the equation? pH is equal to HCO3 divided by PCO2. So here, what will happen to this equation? The PCO2 rise. So what will happen to the pH? pH decrease. These two inverse. So this is because due to respiratory cause, due to ventilation, so it is called respiratory acidosis. If this condition persists, the kidney respond to low pH by reducing excretion of SCO3. How the kidney respond? As you know, we have PCO2 and SCO3. So PCO2 increase, the kidney should increase SCO3 in order for the pH to return to normal, for these two, for maintaining this ratio. So thus, restoring the ratio of SCO3 to dissolved CO2 by what? By reducing excretion of HCO3. So kidney decrease its excretion of HCO3 or increase reabsorption of bicarbonate. So HCO3 is also increased in order to return the ratio to normal, and this is called, if this happens, is called compensated respiratory acidosis because it's compensated by the kidney. What about respiratory alkalosis? Respiratory alkalosis is caused by hyperventilation, like psychoneurosis, and we say decrease CO2, hypocapnia, hypocalcemia will happen, and these are all features of tetany that we discussed. And another cause is high altitude. High altitude also because of hyperventilation, but here due to low PO2. In high altitude, because of the low partial pressure of oxygen, there will be hyperventilation. So when there is hyperventilation, CO2 will remove more, and this will cause decrease in the H and increase in the pH and cause alkalosis. So these are all causes of the respiratory alkalosis. And respiratory alkalosis, kidney also can compensate. So this is one of the features of tetany that you might see. As we said, the person have muscle spasm because of the increase in the free calcium decrease in the free calcium level. As you know, decreased calcium will cause increase in the excitability, and this will be due to hypocapnia and tetany and hyperventilation. And it is very easy. Its treatment, its initial treatment is by giving a kiss to a patient or a bag that the patient breathing through it in order to inspire the CO2 that the patient exhale. So inspiring his own CO2 is important because the problem is by removal of the CO2 or decrease in the CO2. So the person breathes his own CO2. By this, the condition will be relieved. An example of the compensation: when there is removal of CO2 from alveoli due to hyperventilation, a removal of excess amount of CO2, alveolar CO2 will fall, and the respiratory plasma pH rise. This will cause respiratory alkalosis. What will happen if the condition persists? And here, you know how we should compensate. We should look at the equation. This ratio: alveolar PCO2 fall, كاتي CO2 chemicurt. What the body should do to the HCO3 of the blood, concentration of bicarbonate of blood? The body should decrease this also. How the body could do that? Through kidney, of course, by increase excretion or decrease reabsorption of SCO3. So respond by excreting SCO3, so the ratio return to normal, return to near normal, of course, mostly in the compensation. The compensation could act in order to return it to near normal. Could be not returning to exact normal level, but it's very good, of course. And therefore, pH is restored, but buffer-based concentration is reduced. Of course, the problem is that this buffer HCO3 is decreased because it will be decreased in the body, excreted more. And this is called compensated respiratory alkalosis. So the kidney can control HCO3 by variable excretion and synthesis. It's very important to change in the CO2 of the blood. Renal compensation for respiratory alkalosis involves decrease in HCO3 reabsorption. Uncompensated respiratory alkalosis is associated with an increase in the blood pH and a modestly decrease in the HCO3 concentration. So if there is not compensated, the respiratory alkalosis, how you know it is not compensated? The body try to compensate, so it decrease HCO3 concentration, but the blood pH is still high. So this is the uncompensated respiratory alkalosis. What about metabolic acidosis? Any disease that causes production of the acids like lactic acid or other acid or non-CO2 acid means the one that not from the respiratory is called metabolic acidosis, like uncontrolled diabetes, any disease that cause, as we said, acid production other than CO2 like lactic acid, like uncontrolled diabetes, severe exercise, prolonged diarrhea. These called metabolic acidosis, or these are the cause of metabolic acidosis. Why diarrhea or prolonged diarrhea cause metabolic acidosis? Because there is HCO3 in the stool. It will release or excrete HCO3 in the stool. That's why excessive excretion of HCO3 will also cause metabolic acidosis. The base decrease, so metabolic acidosis will happen. In metabolic acidosis, the compensatory mechanism is respiratory system. Metabolic acidosis alkalosis habuton compensated by respiratory system. What do you think? How respiratory system compensate for this metabolic change or metabolic acidosis? Acidosis يعني چی؟ يعني اجزوره باش. Kata cheap gravity basha. It will remove CO2. Although the problem is not in the CO2, it is due to other acid, but the body try to remove more CO2. How the body remove more CO2? It will increase rate and depth of ventilation, so it will cause hyperventilation, stimulate the respiratory center, of course, stimulate the peripheral chemoreceptor to cause hyperventilation. I will ask you a question. What do you think? Which receptor metabolic acidosis or alkalosis stimulate? Is it central or the peripheral chemoreceptor? It is peripheral, of course. Why? Because there is change in the H. And we said only the peripheral chemoreceptor can sense the change in the H ion. Okay, so the compensation is hyperventilation. That's CO2 decrease. This is a compensatory. In metabolic acidosis, hydrogen carbonate is displaced from plasma as the acid is buffered. So when we have acid or H, in order to become buffered, HCO3 removed from plasma. That's why HCO3 decrease, bicarbonate decrease. It tried to remove the H or the acid from the plasma. Therefore, the pH of the blood fall. This is a reduction of the buffer base. That's why the buffer base will be decreased. And the ratio of the SCO3 over dissolved CO2 may be restored near to normal by lowering PCO2. So in the acidosis, metabolic acidosis, HCO3 decrease, as we said, because H increase. In order to buffer H, HCO3 decrease. So we should decrease CO2 in order to maintaining this ratio. By what? By compensative mechanism. But there is depletion of buffer base here, and this depletion remains. In metabolic alkalosis, what's metabolic alkalosis? There is production of bicarbonate that retain in the plasma. So again, in the metabolic acid-base imbalance, HCO3 will change. If you remember, in the respiratory imbalance, CO2 change, but here HCO3 change. So when HCO3 retained in the plasma increase, we should increase CO2 in order to compensate. But let's see first what are the causes of increase in HCO3 in the plasma or metabolic alkalosis. Because the causes are repeated vomiting. Why repeated vomiting cause the metabolic alkalosis? Because in the vomitus, in the stomach, we have H or proton. Kati absorb alkalosis, and the cause is due to other than respiratory causes, repeated vomiting with excessive loss of HCl. In metabolic alkalosis, respiratory system compensate. How it compensate for alkalosis? There should be decrease in the activity of respiratory center, decrease in ventilation, so in order to cause retention of CO2 or increase in CO2. This is the compensatory one. So, as summary, we have this equation, the pH is equal to the HCO3 divided by PCO2, or HCO3 concentration divided by CO2. If we have decrease in the CO2, what does it mean? It means this is respiratory problem. Okay, so we have a respiratory abnormality. We should look at the pH. The pH rise, this means that it is respiratory alkalosis. So if we have decrease in the CO2, this also means respiratory. But if we have near normal pH, what does this mean? This means it is compensated respiratory alkalosis. Okay? How we know that? We should look at the HCO3. The HCO3 should also be decreased for the pH to get to near normal. So this is compensated respiratory alkalosis. We will now come to the metabolic. Or for example, when we have decrease in the pH, means we have acidosis. We should look at the HCO3 and CO2 to know which one is the problem and if it is from metabolic or from the respiratory. So if we have decrease in the HCO3, so decrease in the pH is due to decrease in the HCO3. This is the primary cause. This means that this is from metabolic. So this one is metabolic acidosis. But if we have decreased HCO3, but near normal pH, this means that it is compensated one. But we should look at the CO2. The CO2 should also be decreased. So this is the compensated metabolic acidosis. So if you look at these figures, you can see we can easily differentiate between respiratory alkalosis and metabolic acidosis, or respiratory and metabolic. But when there is compensation, there's a somewhat problematic. How? You can see the equation are nearly the same. Both of them associated with a decrease in the HCO3 and CO2. Look here, in the compensated respiratory alkalosis, because it is compensated, both of them decrease. In the compensated metabolic acidosis, both of them decrease. So, and the pH is near normal in both of them. How we should know if it's previously it is respiratory or metabolic, if it is alkalosis or acidosis? Do you know by what we know? We say pH is near normal, so it is not normal. If the pH is more than more than 7.45, it means this is alkalosis. And if it is alkalosis, means it is due to removal of decrease in the CO2. Alkalosis is not caused by decrease in the HCO3. It is caused by decrease in the CO2. So this is the primary cause, and this is the compensation. Well, if the pH is less than 7.35, means low pH means acidosis. And HCO3 decrease is the primary cause of the decrease in the pH of the acidosis. So this is the primary cause, and decrease in the CO2 is compensation. And thank you.